Okay, I'm going to talk about the different modalities that are involved with radiology. I've listed out the most common ones here: CT, MRI. So CT is like CAT scan, MRI um, is going to use a magnet, ultrasound, X-ray, nuclear medicine, and mammography. I've listed mammography separately here, but for the most part, the principles are all the same as X-ray. It's just it's just a specialized field related to breast imaging. So, one of the distinguishing things that we need to be aware of is whether radiation is involved or not. So, with CAT scan, it is using radiation, so that means it's potentially a risk to the patient. So, we don't want to over image patients with CAT scans. So, we want to make sure that we do the protocol correct the first time so that we don't have to repeat things. It takes about 50 seconds up to 3 minutes depending on what kind of CAT scan you're doing. So for instance, a brain head CT, 35, 40, 50 seconds. Whereas if you're doing a chest CT or an abdomen pelvis CT, it's going to take a good 3 minutes at least. You can use contrast. Iodine contrast in CT is something that helps you see structures better. So what happens is a a structure may look gray on a non-contrast CT, but if you give contrast, it tends to go to areas of inflammation. So maybe you have a mass in your liver, you can barely see it without the contrast, but if you give the contrast, it's going to light up and be real bright and easier to see for the radiologist. It also will help you kind of characterize different tumors and things like that better. Um, and then when you're looking at the bowel, it's a little bit difficult sometimes to see like the appendix and things like that without the contrast. So it's always good if you can give contrast. It's a helpful thing. CAT scan, I put here, it's a good screening tool, and what I mean by that is you can image large areas. So again, even though there's a radiation dose involved, it's not uncommon, for instance, in a trauma patient, to do a head, a cervical spine, a chest, an abdomen, and a pelvis CT. So basically, you've done a CAT scan of the majority of the body. So it allows you to get a good global image of all kinds of different structures, whereas some of the other modalities are not very good at screening tools. So that's an important thing to keep in mind. It does allow you to get a good picture of all the internal organs. So, you're talking about your liver, your kidneys, your spleen. It's really good for looking at the bowel. However, its limitations are that it's not really that great for looking at muscles and superficial soft tissue. So if you strained a muscle or you tore a muscle, CT may not be the best imaging choice for you there. Also, if you have an infection in the soft tissues, say you have a diabetic that you think has an abscess in their foot or wherever, it's not going to be as easy to see by CT as it is by other modalities. Um, However, again, if we're talking about things within the abdomen, um, so for whatever reason, an abscess within the abdomen you can see pretty easily with CT. The terminology that you're going to hear associated with CT or CAT scans is the word density or attenuation, um, and that's that's important to key in on, because if you use the wrong terminology with a modality, it really takes away a lot of your credibility in terms of knowing what you're talking about. So anytime we talk about the color of a lesion in the body, so say we're looking at the head CT and we see something that's white, we're going to say that that's hyperdense, or it's going to be high attenuation. Whereas if it's black or dark, it's going to be called hypodense or low attenuation. So that's just kind of the normal terminology we use. CT scanners are usually described in terms of the number of slices, and the slice number is really the number of detectors. So you have a radiation source that shoots out an electron, goes through the body, and then there's a detector to capture that electron on the other side of the body. And so we call those detectors slices typically. So you're going to have an 8 slice, a 16 slice, a 64 slice CT scanner. Um, you don't typically see much below 8 slice anymore. You can see some in doctors' offices and things like that. But there's a radiation dose curve that goes along with the different slice thickness, and so really anything below an 8 slice CT, you're giving your patient a little bit more radiation than you should be, certainly more than if you had done a 16 or a 64 slice scanner image. The most common machines that you're going to see, at least around this area, is typically the GE Lightspeed, but there's other makers, Siemens and Philips and Toshiba, so you'll see those sometimes, but I think the most common is the GE. The images that you're going to produce, it's really just shades of gray, and that's that you can't overstate that enough. I mean, you're literally talking about thousands of shades of gray. Um, so when you look at a structure, if it's air, it's going to be black. If it's soft tissue, it's going to be kind of a grayish color. If it's fat, it'll be black, but it's not as black as air. And then white is really going to be either contrast or bones, and then an even more solid, really bright white tends to be metal. And but like I said, there's a whole bunch of different colors in between there, so it's not like there's just 4 or 5 colors, there's thousands. And this is an image of your typical CAT scan machine. So you can see here, your patient is right here. They're going to sit on the scanner. This bed is actually going to go in and out. So once she starts scanning, the electron source is shooting an electron from here, and it's spinning. Sorry about that. It's actually spinning in a circle really fast as the patient is going through the scanner. So on one side is the electron source, on the other side is the receptor for the electron source, but the whole mechanism is spinning quickly. You'll notice that even though the technologist is standing here, when she actually does the image, she'll be sitting in this room here. This is lead lined glass, so she's going to sit out here and observe the patient. She'll use this computer here to monitor the images, but she is not going to be in the same room as that patient because she doesn't want to get radiation exposure. The next thing I'm going to talk about is MRI, so magnetic resonance imaging. What this is doing is using a magnetic field to generate images. So your body is filled with protons, and these protons are naturally moving all over, and they're spinning in their natural state. And what happens when you hit them with a magnetic field, it's going to cause the protons to line up, and then depending kind of on the concentration of protons within a tissue, they're going to relax at different rates. And so you can use a computer analysis basically to generate an image by calculating the relaxation times of, different protons in your body. And that's kind of a simplified explanation of it. There's a lot more to it that's going on than that, but that kind of gives you a basic understanding of what's happening. Um, the key thing here is there's no radiation involved at all. So if you do an image of someone's brain, for instance, and they moved around, you can repeat the image, and it's not going to cause them any harm. It's just a matter of it takes a little bit more time if you have to start repeating images. Typically, it's going to take a lot longer to do these examinations because it's collecting signal over time. So it's not like a CT scanner where it shoots an electron and catches the electron on the other side and that makes the image. This is actually collecting data over a period of time, and that's using a Fourier transformation algorithm to actually make the image. So 25 to 45 minutes is definitely reasonable amount of time. The MRI is the machine that makes that real loud banging sound. So it sounds kind of like a machine gun. So it's just going da 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 da. That's the sound that the MRI is making. You can use contrast for an MRI, and again, this comes into a little bit of terminology. When we say contrast, typically we mean CT and we mean iodine. When we say when we're talking about MRI, instead of iodine contrast, it's actually gadolinium. So we're talking about enhancement with gadolinium with an MRI versus iodine contrast with CT. The important thing here as well is that MRI is not a good screening tool at all. And that's one thing that a lot of clinicians don't understand. You really have to have a very tailored exam. So, for instance, you can do an MRI of the shoulder or you can do an MRI of the heart, but it doesn't do a very good job of doing an MRI of the chest. And that's partially because all the air in the lungs just really don't show up very well on an MRI because, as you can imagine, there's not a lot of protons within the air that we're breathing, not a lot of free protons, and so it doesn't make a very good image. Um, and you tend to have loss of signal at the margins of whatever you're imaging. So you really can't do like a chest, abdomen, pelvis with MRI. So if you're doing something in the abdomen, you may do a liver MRI or you may do kidney MRI. If you're doing the brain, you're going to focus just on the brain. If you want to look at the neck, you would do a neck MRI or a thoracic spine or lumbar spine, and then you can do extremity MRIs like a knee MRI or an ankle MRI, a hip, a shoulder, things like that. But for instance, you would not do a complete arm MRI or a complete leg. That would be too big of a field of view and it wouldn't work. So again, I kind of talked about it here. It's really good for looking at the internal organs, the brain, and then musculoskeletal things, but it's not good at all for looking at the lungs. And it's also not good at looking at the bowel because the bowel tends to move around, and that again, it's collecting data over time. So if the bowel's moving, then the image is going to be really blurry due to the motion. Terminology you're going to hear again with MRI compared to CT is the word intensity. So if it's bright, it's going to be hyper intense. If it's black, it's going to be hypo intense. So that's opposed to the word density or attenuation, which we used with CT. MRI machines are described in terms of the strength of the magnet, and the unit that they use is called a Tesla. So you may see a 0.2 Tesla magnet, a 1 Tesla, 1.5, a 3 Tesla. Um, most of the higher end magnets are the 1.5 or the 3 Tesla. Anything below the 1.5 is usually kind of a cheaper magnet. And the reason that's important is the lower strength magnets tend to have a lot worse resolution, so your imaging quality is not near as good. The imaging quality between a 1.5 and a 3 honestly is pretty similar, but there is a little bit of improved resolution with a 3 Tesla magnet. The most common machines around here is the Siemens, and I put that closed versus a Hitachi open, and I'll show you a picture in a minute. But a closed magnet requires you to go into this bore. It's kind of a tube that you're going to go inside, and it's going to take the images that way. Whereas the open magnet is for patients that are claustrophobic, and so that's going to give you, um, you know, a lot bigger open space, so it's not going to make you as claustrophobic. In general, MRI is good for looking at soft tissues, and again, we kind of talked about this a little bit. The the two main sequences with MRI are T1 and T2, and that's really the relaxation time of the protons after they're hit with magnetic wave, and so we're talking about the relaxation on T1 or T2. This is a picture of an MRI. So you notice the patient's going to go inside. This is a closed bore, so it's a relatively small area that you're going into. So if you're claustrophobic, it's going to make you feel pretty crazy going inside of this. They can put you in head first or foot first, just depending on what they're looking at. And again, there's a really loud banging noise. So you see the headphones sitting over here. Typically, the patient will wear the headphones. One thing they're not showing you here is the patient will have to wear a coil over whatever part we're imaging. So it kind of looks, if they're doing a head, it looks like a headset, kind of almost like a helmet. They can put one on the ankle. But if you look over here, for instance, this is probably either the shoulder coil or an extremity coil of some sort. This looks like it's probably the head coil sitting up here that we can kind of partially see. Um, for the technologist, if he wanted to stand in the room while he was imaging, he certainly could because there's no radiation. So they tend to walk in and out of the room to check on the patient. But again, remember, this is a huge magnet, so we don't want any metal in the room at all. So the technologist has to be really careful not to have any metal on them. So if they come in there with their keys or their cell phone or something like that, it's going to get pulled inside that magnet. And this is a picture of an open magnet, so you can see there's a lot more space right here, so the patient does not feel near as claustrophobic. The downside of these open magnets is they're a lot lower Tesla, so they're fairly blurry images. They're not near as good quality as you get with the closed magnet. So ultrasound is using a sound wave to make the images. So it's shooting a sound wave out, hits a structure, bounces back, and then it hits a receptor on the ultrasound machine, and that's what's actually making your image. So there's no radiation involved at all. A typical scan is going to take about 15 minutes. But again, if the sonographer wanted to scan longer than that, they could. It wouldn't be any harm to the patient because there's no radiation involved at all. Now, ultrasound is a pretty good screening tool. It's good at looking at the surfaces of organs. It's good for looking at pockets of fluid. But because you're using a sound wave, it travels well through fluid, but it does not travel well through air at all. So that makes it very challenging when you're trying to look at the abdomen. So if you have a lot of bowel gas, or if your patient has just recently eaten, they're going to have a lot of air in their bowel, and it's going to make it almost impossible to see any of the structures within the abdomen. The terminology used with ultrasound is the word echogenicity. So if it's bright, it's going to be hyperechoic. If it's dark, it's going to be hypoechoic. Um, Again, CT is density or attenuation, MRI is intensity, ultrasound is echogenicity. That's just terminology that shows you know what you're talking about. Um, the grayscale is probably the most common exam you're going to see on ultrasound. It's what allows us to actually see pictures, but there's a lot of different techniques you can apply to kind of tweak the picture or to see moving blood and things like that. You can measure the velocity of how quickly blood is moving. And that, so you're looking at color Doppler, spectral Doppler, and power Doppler, just kind of other ways that you can use your ultrasound machine. Most common around here is probably GE or maybe a Siemens. Um, the soft tissue again is going to be gray or white. Fluid is going to be black or anechoic. If it has a little color to it, you may call it hypoechoic. But again, it does not travel well through the air, so that's good to keep in mind. This is a picture of an ultrasound machine. This is your typical bedside machine, so it's a pretty good size, cumbersome machine. It has wheels so you can roll it around, but it's still pretty good size. Sonographer sitting here. This is the transducer right here. So he's looking at the image, so it's sending a sound wave into this guy. It's hitting his liver and then coming back to the receptor, and it's generating this image. So that's how we're seeing this picture right here. I put this here just to show you that there are some mobile ultrasound machines that work pretty close to as good as the actual big machine. They're a fraction of the price. They're mobile. You can take them with you in your car. They're a lot easier to work with. So you'll see these mobile machines in the mobile setting a lot. X-ray is also using radiation to make an image. For the most part, the principle is similar to a CT machine. It's shooting an it's shooting a electron out, goes through the body and hits a film on the other side. So whether that film is old school film or a digital receptor, it's going to basically hit a film on the other side and allow you to perform make an image. I put you can use contrast as a drink. That's really not for typical x-rays. It's more if you're doing something called like an esophagram or a small bowel study. So that's where they're taking numerous x-rays repeatedly. So they'll have you swallow some contrast for an esophagram, and they'll take repeated x-rays quickly as you're swallowing. So you'll see the contrast go all the way down, but you're actually probably taking 15 or 20 different x-rays to do that. But again, so a typical x-ray like a chest x-ray or something like that, you don't use any contrast. For the most part, x-ray is a pretty good screening tool. You can see big areas of the body. You don't have you don't tend to have a lot of signal drop off at the margins. It's really good for looking at bones, obviously for fractures, things like that. It's pretty good at looking at the lungs. It's good at looking at the bowel. So the fact that the bowel's moving doesn't bother x-ray very much because the exam is so quick. Even if your bowel moved a little bit, it's not going to make a huge difference. The terminology used with x-ray is the same as CT, so we're talking about density. And again, that's important to remember. The machines can be mobile or fixed structures. Um, Mobile X-ray machines have gotten a little bit of a bad name. They tend to magnify structures that they're looking at, and really what it is the technologist just needs to be more diligent with their technique. So for the most part, if you have a technologist that has good technique, there's not a huge difference in the quality between mobile and a fixed X-ray machine, but there certainly is a small difference. Um, Again, you're looking at shades of gray, so black is either going to be air or fat. Gray is going to be kind of soft tissues. White is going to be bone, or potentially metal. Um, there's less radiation than the CT for sure. You're probably needing, I don't know, 15, 20 X-rays to come close to a head CT, for instance. So the radiation dose is quite a bit less for an X-ray than it is for a CT. Again, we kind of talked about mammography. It's basically an X-ray. It's just of the breast, so it does have its own category, but it's not a whole lot different. So this is your typical X-ray machine. So the X-ray machine is here. They can move it around the room. It's mobile. It's hanging from the roof. Um, your X-ray your film is actually under the patient, so your X-ray source is going to come from the top, go through the patient, and then hit the film, which is underneath them. And again, although the technologist is standing here, she's just going to set the field of view up that she wants to image, and then she's going to step out of the room because this has radiation, so she doesn't want to stand in there when she does the actual X-ray. And this is a picture of a mobile X-ray unit, so you can see it's quite a bit smaller, easy to move around. Got wheels, has some wheels here, pretty stable structure. This is the X-ray source here, so the X-ray is going to come out of here. So in this case, they would have to put the cassette on the other side of the patient. So the X-ray is going to come out, go through the patient, and then hit the film. So there's definitely some challenges to doing good work, but if you have a diligent technologist, they can certainly do a good job with it. Nuclear medicine is a little bit different in the sense that we've been talking about an external source of the radiation. So we've been shooting an electron from outside the body, going into the body, and then hitting the film on the other side. Well, nuclear medicine is different in the sense that we usually will inject the patient with a radioactive substance, which is going to then release radiation. And so we're actually measuring the radiation that's leaving the body in that certain area. So again, it's using radiation, so it is risky to the patient in the sense that we're giving them some radiation. It obviously, in a general sense, should not harm them, but you don't want to do repeated exams. It would be too high of a dose of radiation exposure. Um, and you're gonna inject multiple different kinds of substances. There's probably 100 different radioactive materials or radio tracers that could be injected. The most common one, probably technetium, but you'll see thallium and xenon and FDG. I put FDG here. That's a PET scan, and it's a little bit unique to itself, but it still kind of falls into the class of nuclear medicine. You basically have injected a glucose molecule that has been altered, and so it's going to be able to be evaluated on a camera. Um, Probably one of the more important things to realize with nuclear medicine is because the radiation is being emitted from inside the body. So you do your injection. Hold on 1 second, please. Hello? Hey. Okay, sorry about that. So you inject the radio tracer inside the body. It's going to go to whatever part of the body that particular agent is specific for. So it may localize to the liver, or it may localize to the spleen, to the kidney. Some of them go to the thyroid. They all have different locations. Some will go to the prostate gland. Some will go to the heart. Um, so whichever one you've injected, it's going to start releasing radiation, and then you're going to have a gamma camera outside the patient, which is going to basically start collecting counts. So whereas with all the other studies we talked about, um, For CT, we talked about density or attenuation. For MRI, we talked about the word intensity. For ultrasound, we talked about the word echogenicity. Well, for nuclear medicine, we use the term counts. So it's collecting counts over time, and that's what it's using to make a picture. So you can imagine, though, that when it's making the picture, it does not make a real high resolution image because it's just counting those radioactive releases. Um, so the gamma cameras on the outside of the body, it will show up black typically, and that's what you're looking at. But it does not give you very good resolution for the structure you're looking at. And so that's, for instance, with PET scans. It's really a PET CT. So what they do is they do the PET scan, which is going to show activity in a certain area, and then they fuse that with a CT that was done at the same time. So the CT will give them the anatomy, they fuse the two images together, and then you can localize where the activity is actually coming from. And I just listed a couple of the more common nuclear medicine studies that you'll see: the HIDA scan, the bone scan, myocardial perfusion studies. So that's, when you go to the ER, you had chest pain and they keep you overnight, they're going to do a myocardial perfusion study, and that's going to tell you the risk of heart attack, how good the blood flow is to your heart. They're going to tell you that. VQ scan, thyroid scan, just a couple other ones. Again, it's a blurry image. It's not going to give you a lot of anatomy, but it's very helpful with physiology. A lot of these can tell you how a certain organ is working. This is a picture of a gamma camera. So again, the guy just sits there. You're going to take the images over 20 to 30 minutes. So this exam would be affected by motion. So we definitely want to keep the patient as still as we can. But for the most part, he's just going to sit there and relax. The radiation will get eliminated from your body naturally over the next couple weeks, depending on what kind of study you had. There are some risks um, and processes that you have to go through when you leave the department, but for the most part, they're pretty safe for other people. All right, thank you very much.